Welcome. Let's look at the cubital fossa. The cubital fossa is a triangular space that is seen in the anterior part of the elbow. This is the elbow joint between the arm and the forearm. In the anterior region of the elbow joint is where we have this depression that is called the cubital fossa. This fossa is a triangular space, and this space has its apex directed downwards. That's why the base is seen towards the upper part. It is also referred to as the elbow pit. It is seen to be created as a depression in the anterior part of the elbow joint. So going further, let's look at the boundaries of the cubital fossa. The cubital fossa, we already said that it is a triangular indentation or depression that is created in the anterior part of the elbow. The base is created by an imaginary line that joins the medial and the lateral epicondyle of the humerus. This is the humerus above, and we have the medial side, and this is the lateral side. On the medial side, we have a protrusion that is called the medial epicondyle, and we have on the lateral side a protrusion that is called the lateral epicondyle. So an imaginary line linking the two epicondyles, that means the medial and the lateral epicondyle, will form the base of the cubital fossa. While we have the medial border formed by the pronator teres. This is the pronator teres muscle highlighted in blue, but what specific region of the pronator teres forms the medial border of the cubital fossa? Let's take a look at this. This is the medial side and this is the lateral side. This is the pronator teres muscle. That means that the medial border of the pronator teres is this region, while the lateral border of the pronator teres is this region. So specifically, if we want to highlight the medial border of the cubital fossa, we'll say that the cubital fossa is medially bounded by the lateral wall of the pronator teres, which means is this region. So this is the region that forms the medial border of the cubital fossa. They're going to the lateral border. The lateral border is formed by the brachioradialis muscle. This is the brachioradialis muscle that is highlighted in green. But talking about the specific region of this muscle that forms the lateral border of the cubital fossa, we already know that this is the medial side and this is the lateral side in anatomical position. So if we are trying to establish the borders of the brachioradialis, we can say that this is the medial border of the brachioradialis and this is the lateral border of the brachioradialis. So specifically, we can say that the medial border of the brachioradialis forms the lateral wall of the cubital fossa. You can see how interesting this is. The basics is for us to be able to establish the different regions in anatomical position. If you know the region that is medial and the region that is lateral, we will be able to specifically establish the regions that form both the medial border and the lateral border of the cubital fossa, as we have established. Then going to the apex. The apex, we say that is directed distally, and it is formed at the point where the pronator teres muscle and the brachioradialis muscle intercept. So this is formed at this region. So this is where the apex of the cubital fossa is created. So going further, let's talk about the floor and the roof of the cubital fossa. For the roof of the cubital fossa, we know that most superficial, we have the skin, and deep to the skin, we have the superficial fascia. Around the cubital fossa, deep to the superficial fascia, we have the bicipital aponeurosis. Bicipital aponeurosis is a broad extension or an aponeurotic network that is formed by the tendon of the biceps brachii muscle. We know that the biceps brachii muscle is seen in the anterior arm, and of course, it extends distally towards the forearm region. At its distal end, it is continuous as a tendon. This tendon tends to form a broad network of sheets that underlies the superficial fascia. That is why we have the establishment of these three structures forming the roof of the cubital fossa. So we have the skin. If the skin is removed and the superficial fascia, then deep to that, we now have the bicipital aponeurosis, which is a broad sheet of tendon-like material that is created by the tendon of the biceps brachii muscle. So those are the structures seen covering the indentation that is called the cubital fossa. Then talking about the floor of the cubital fossa is formed by two structures. It's formed by a bony compartment and also a muscular compartment. The bony compartment should come so easy. We should know that the bony compartments that form the floor of the cubital fossa should be the lower part of the humerus, the proximal part of the ulna, and also the proximal part of the radius. So these three bones will form the bony configuration of the floor of the cubital fossa. And this is the distal part of the humerus. We have the proximal part of the radius and the proximal part of the ulna. Then going to the muscular compartment that forms the floor of the cubital fossa, we have the brachialis muscle proximally. The brachialis muscle is a deep muscle that is seen in the arm region, and part of it does extend across the cubital fossa. And it is in this region that it tends to form part of the component that is seen at the floor of the cubital fossa. So you see it at the upper part, and more distally, we have the supinator muscle. This is the supinator muscle highlighted in black. This muscle curves around from the posterior part and extends into the cubital fossa in the anterior region. Then looking at the content, the cubital fossa, we say that it's the depression that is created in the anterior part of the elbow joint. It is also good for us to know the structures that are contained within this depression, and that will take us to the content of the cubital fossa. We have first the biceps brachii tendon. We have the brachial artery. Under the brachial artery, we have subdivisions of the brachial artery, and we have the radial artery, we have the ulnar artery. We also have the anterior ulnar recurrent artery and the radial recurrent artery. Then we have the medial nerve and the radial nerve. These structures will be taken one after the other to see where they are specifically placed within the cubital fossa. So let's go through with this lecture to see how this will be unfolded. So first, for the biceps brachii tendon, we already know that the biceps brachii muscle is a two-belly muscle that is seen in the anterior part of the arm, and this is the muscle highlighted in blue. It has a long and a short head. The short head of the biceps brachii muscle extends from the coracoid process of the scapula above, and also the long head extends or originates from the supraglenoid tubercle around the shoulder joint. So as they extend from above, they descend down through the anterior surface of the arm. As they descend down distally, they become continuous as a tendinous structure. So they are muscular at this region. As they get to the distal region, they become transformed into tendon. So it is this tendon around the region where it crosses the cubital fossa to be inserted on the radial tuberosity. Down here, this is the ulna, this is the radius. So it descends down to be inserted in the radial tuberosity. That is the tendinous continuation of the biceps brachii muscle. Around that region, it becomes a content of the cubital fossa. So this is one of the structures that forms the content of the cubital fossa. To make this lecture more interesting, it is good for us to know that the biceps brachii tendon forms like a central structure that is seen in the cubital fossa. And that is what is going to be used to establish our learning direction. So let's look at the tendon of the biceps brachii muscle. We already said the biceps brachii muscle is highlighted in blue, and it becomes continuous as a tendinous structure. And this is the tendinous structure that also forms part of the content of the cubital fossa. Because it is seen at the central part of the cubital fossa, this will be used to create like a landmark and will be used to direct our study. So this is the tendon of the biceps brachii muscle, and at the central part it is located. So adding to the content of the cubital fossa, we are going to be studying this content based on their relation to this centrally placed biceps brachii tendon. So we look at the medial side and we look at the lateral side. So on the medial side, we have structures that are contained in the cubital fossa and are located medial to the tendon of the biceps brachii muscle. And also we have some structures also located in the lateral part of the biceps brachii tendon. So let's first take a look at the structures that are seen at the medial side of the biceps brachii tendon, even though we already established that the tendon of the biceps brachii muscle is a content of the cubital fossa, although centrally placed. So looking at the medial side, the first structure that is seen very close to the tendon of the biceps brachii is the brachial artery. And this is the brachial artery that is highlighted in black and coated in red. You can see it is immediately located medial to the biceps brachii muscle. And that is one of the structures that is seen in the medial region of the biceps brachii tendon that forms the central landmark of the cubital fossa. This brachial artery is a continuation of the axillary artery. This we talked about in our lecture on the axillary artery. If you've not checked that lecture, please kindly go and check it up to upgrade your knowledge. The brachial artery is a continuation of the axillary artery. So as it descends down in the anterior part of the arm, it divides into two arteries. It divides into the radial artery and it divides also into the ulnar artery towards the apex of the cubital fossa. So we have the brachial artery dividing into the radial artery and also the ulnar artery. So it's also good for us to add the anterior ulnar recurrent artery. This is the anterior ulnar recurrent artery. This artery emerges from the ulnar artery, which is a division of the brachial artery. As the anterior ulnar recurrent artery emerges, you see it ascending upward. So this is one of the structures, the medial components that are seen in the cubital fossa. Going further, we have the median nerve. We said that this is the tendon of the biceps brachii muscle. Medial to it, we have the brachial artery. Then medial to the brachial artery, the next structure that is seen is the median nerve. This is the median nerve highlighted in green, and it is seen medial to the brachial artery. This median nerve is one of the terminal branches that is formed from brachial plexus, and it is formed from both the medial and the lateral cords of the brachial plexus. We also have done a lecture on the brachial plexus. Kindly go and check that up to upgrade your knowledge. So we have the median nerve located medial to the brachial artery, and this is also one of the structures seen in the medial region of the cubital fossa. We talked about the medial and the lateral components that are located to the tendon of the biceps brachii muscle. We've talked about the medial component. We're going to the lateral compartment. Let's look at the lateral region and the structures that are contained within this space. The first structure is the radial nerve, and the radial nerve is also one of the terminal branches of the brachial plexus. So it is seen between the radiobrachialis and also the brachialis muscle. So these are the two muscles, and between these two muscles, you see the radial nerve passing through them. And as it passes through them, it is seen at the lateral part of the cubital fossa, also further dividing into a superficial branch and also a deep branch. So that is how we have the radial nerve as part of the structural content or component of the cubital fossa, but it is located lateral to the tendon of the biceps brachii muscle. Then also to add that we have radial recurrent artery, as we have the anterior ulnar recurrent artery on the medial side. On the lateral side, we have the radial recurrent artery, and this is the radial recurrent artery. The radial recurrent artery emerges from the radial artery. Remember, we said that the radial artery is a subdivision of the brachial artery. So as it divides, it gives a recurrent branch that also goes upward to supply the elbow joint, the brachioradialis, the radialis muscle, and also other forearm muscles. So that is how we have the emergence of the radial recurrent artery on the lateral side of the cubital fossa. It's good for us to check this out because of its clinical application. In the vicinity of the cubital fossa, although not a content of the cubital fossa, we have the cephalic vein, the medial cubital vein, and also the basilic vein. These three veins are seen to be superficial to the cubital fossa. They do not form part of the content because they are not seen within the depression that is called the cubital fossa, but they are seen on the surface. This is the cephalic vein, and this is the medial cubital vein. Then we have the basilic vein. You can see these three veins form like a kind of network and around the superficial part of the cubital fossa. So we have the cephalic vein connecting with the basilic vein through the medial cubital vein. So let's go to how this is used for clinical application. These vessels, we said that they pass superficial to the cubital fossa. It means that they are easily accessible. So it can be used for intravenous injection and also used to obtain samples of blood for test. The medial cubital vein, which connects the cephalic vein and the basilic vein. This vein is large in size, and this is one of its benefits in the usage for intravenous injection and also for obtaining blood samples so that the needle can easily pass through it to collect blood sample for this purpose because of its size and also its superficial nature. Also, we have the brachial pulse. The pulse of the brachial artery can also be felt within the cubital fossa. Remember when we talked about the content, we talked about the brachial artery, which is a continuation of the axillary artery upward as part of the structural component of the cubital fossa. So the pulse of this vessel can be felt within the cubital fossa. And considering the knowledge that we've acquired during the course of this lecture, we know the position where the brachial artery is placed and where this pulse can be felt. And this is the brachial artery highlighted in black and also quoted in red. You can check our understanding of this lecture through the following questions. Outline the boundaries of the cubital fossa. This we have effectively established during the course of this lecture. The second question is to describe the content of the cubital fossa. And this is a very interesting question that we should be looking forward to. Then the third question is to list some clinical applications of the cubital fossa. I'll be expecting your responses in the comment section, so stay tuned for more lecture updates. Thanks for watching.